we are looking at the teratogenic drugs. So we're looking at the teratogenic drugs along with their birth defects. So the questions is, what is the role of the progesterone and what effects does it bring to the child? So next is, what is the effect of valproate? And third is, what is the role of statins? What does statins cause? So by the end of this video, you will know the answers to all these questions, and there are some bonus questions in the end. So to start with, penicillamine. So the penicillamine, the adverse effect is cutis laxa syndrome, that is CLS, that is cutis laxa syndrome. Then we look at lithium. So in case of lithium, it results in the Epstein anomaly. Now moving ahead, we look at the isotretinoin. Isotretinoin. So if you see isotretinoin, it results in the facial ear anomalies. Facial ear anomalies, as well as it can result in the heart diseases and the CNS anomalies as well. Now moving ahead, we look at the progesterone. So the progesterone is nothing but it results in the masculinization. So the masculinization of female fetus. Then we move ahead and look at the quinine. So the quinine, it results in the abortion. It results in the abortion as well as the thrombocytopenia and deafness as well. So next we look at the drug, that is topiramate. So what is the topiramate? So topiramate, it can result in the cleft lip formation. Then we look at the valproate. So what is valproate? Valproate, it can result in the spina bifida. So valproate results in spina bifida. It also results in the limb defects. Limb defects, it can result in autism. It can result in autism spectrum. So autism spectrum disorder. Then there is also the facial as well as the cardiac. Facial and cardiac anomalies which are associated. Then there is also the coarctation of the aorta. So there is coarctation of the aorta as well as there is presence of the aortic stenosis. Also there is the pulmonary atresia and the VSD, which is nothing but the ventricular septal defect. So after this, we look at the vitamin D. So vitamin D is also teratogenic. That is, it can result in the SAS, referring to the supravalvular aortic stenosis. Supravalvular aortic stenosis. So next we'll check on the warfarin. So What is the warfarin? So if we look at warfarin, it is causing the fetal bleed. It results in fetal bleed as well as the hypoplastic nasal structures. Then we move on to the statins. So what are statins exactly? So statins, they form the vertebral, anal, cardiac as well as the tracheoesophageal fistula and also renal, arterial and limb defects. So in short, taking all the first letters in place, it is known as the vectoral defects. So just to repeat, it is the vertebral, then also the anal, cardiac, tracheoesophageal, fistula, renal, arterial and limb defects. Now to move on, we look at the phenytoin. So looking at phenytoin, it causes the VSD. VSD is nothing but the ventricular septal defect as well as the ASD referring to the atrial septal defect. Next, it also results in the coarctation of the aorta. The coarctation of the aorta. And it also results in the PDA. PDA refers to the patent ductus arteriosus. Now, next we move on to the AC inhibitors and the ARBs and their role. So, AC inhibitors as well as the ARBs. This results in the hypoplasia. The hypoplasia of organs as well as results in the anuria and the irreversible renal failure. Next, we look at the CAR, that is the carbimazole and the methimazole. So what is the carbimazole and methimazole? They result in the choanal atresia. It leads to aplasia cutis as well as the tracheoesophageal fistula as well as the fetal goiter. Next, we look at the role of the alcohol. So alcohol can result in the ASD referring to the atrial septal defect as well as VSD referring to the ventral septal defect. So now we are jumping to answer our questions. So the first one, looking at answers, the first answer, the question was what is the role of progesterone? So the progesterone, what it does, it causes the masculinization of the female fetus. Next, we have valproate. So what is the valproate doing? The valproate, if you see, it can result in the spina. It results in the spina bifida. It can cause the limb defects. Next, it can also cause the ASD, that is a atrial septal defect, that is disorder. Then the facial as well as the cardiac, facial as well as the cardiac anomalies. Then comes the coarctation, coarctation of the aorta, coarctation of the aorta. Then comes the aortic stenosis, and then the pulmonary atresia, and the VSD referring to the ventral septal defect. So post this, we also asked the question, what is the role of the statins? So now looking at the role of the statins. So what does statin do? Statin, it results in the vectoral defect. So what is meant by the vectoral defect? So V stands for there is V for vertebral, A for anal, then comes C. C is for the cardiac, then T for the tracheo, esophageal. Then comes the F, renal fistula, then comes R for the renal, A for the arterial, and then comes the L for the limb defects. So this in short is the vectoral defects. So these are the effects of statins. So now moving on to our bonus questions. So these answers you can write it in the comments. So the bonus questions, it includes firstly the AC inhibitors and the ARBs. AC inhibitors and the ARBs. The question is, what are their teratogenic effects? The second is, what is the teratogenic effect of vitamin D? Lastly, what is the effect of the quinine? What is the teratogenic effect? So all these answers, you can write it in the comments.